Hi, Dave. Hi, folks. It's Kyle. Welcome to the Dave and Kyle Show. We are here to improve the healthcare system together. We're exploring different kind of technologies, how AI and telehealth can make more of an impact on our everyday work as providers and executives. So, David, tell us what's going on today.
Hey folks, hey Kyle. Good to see everybody. And I like the new and improved episode hook you got there, Kyle. Today's episode is about saving lives with telehealth. Is it possible? So a lot of us, we know that we can zoom in and talk to our doctor on the phone or on Zoom. But did you know that ambulance EMTs can actually zoom in to emergency physicians in different parts of Georgia to not only diagnose what conditions patients have, but also route them to the closest hospital to provide the fastest amount of transportation. Keep listening to hear how telehealth can actually save lives.
And it's not just with their phones either, which is something I think will be worth talking about. Um, Thanks to the sponsor. Quick thanks to the CE app. You can just go to myceapp.com, sign up for free to manage all your continuing education, CE, CME, and license credential renewals in seconds. So can telehealth save lives, specifically in the emergency settings? It's interesting because ERs you don't think of as your phone as an ER alternative or anything like that. To show us the article that we're looking at today.
Perfect. Well, we this certainly is more sophisticated than just a phone call. Today, our article comes from let's see, comes from Healthcare Innovation. Can you see my screen, Kyle?
Yes,
What I'm looking
yeah,
at. Perfect.
yeah,
We're sorry, guys. We're trying out this new software, so
and it's
maybe
looking
some
good.
bumps. So it's about a mobile telemedicine system that connects EMTs in rural Georgia to medical professionals. It's an article from Healthcare Innovation, hcinnovationgroup.com. And the gist of the article, it's kind of like having a big brother in a box, so to speak. So here are some pictures of the inside of the ambulance, and here's a picture of the actual telemedicine going on. So you can see here, imagine, you're an EMT in the ambulance, you have a patient on this bed right here, you're riding and trying to save this patient's life. You're in the middle of Georgia, about 2 hours from the nearest hospital, so to speak. How do you save this person's life when time is ticking? Well, according to this article, Washington County Regional Medical Center, they have a collaboration with DT Research and SWIMED. They have a mobile EMS telemedicine system, essentially connecting these paramedics, these EMTs in rural Georgia to emergency medicine physicians at Emory Hospital. So they can actually dial in from the ambulance, call somebody at Emory, which is a big hospital in Atlanta, Georgia, I believe. And you can see right here, you can see all the vital signs. You can see live feeds of data from the patient. You can actually talk to the doctor and get their live feedback and input on not only what the patient has, but also the closest hospital, the different options that they have. So super cool technology is currently funded by a research grant from HRSA, a governmental agency from the feds, I believe, to kind of pilot this research and this initiative. But I think it has legs to expand into this kind of bigger service, not only from Emory and this collaboration, but every single hospital in the US, maybe even a startup that could come out of this. So enough sharing and talking about this technology. Kyle, technology guru, I want to hear what your thoughts about this. Does this have
Yeah,
legs?
yeah. I mean, my first thought is, especially if it's federally funded right now, is it efficient? Is it efficient enough to make it through the wave of cutting inefficiencies out in our government that's happening right now? I think the alternative is, well, you could just use your phone, right? You could get somebody in a EM physician on a phone and get in touch with them that way. Yeah, that's fine. You could talk, but I think there's a lot of value in the other offerings here around the um, being able to send the vitals in real time, these sorts of things, the data that's coming out of the actual um, uh, connection with that patient at that time instead of just words, because oftentimes in an emergency situation you don't really have the time to say, well, here's what this looks like, here's what that looks like. Yeah, I think it does. And even beyond technology, I think it's about um, equity in a way where giving rural communities the kind of access to great level of care that otherwise wouldn't really be available. You'd have to, send out the chopper. We've had one episode where I forget what the grand total of what these people were billed, something like $300,000 for a chopper ride to the hospital that insurance said wasn't necessary. So I think it could save a lot of costs in the end. Even though the technology itself is probably pretty expensive to install initially, it's kind of a low cost to maintain it ideally. Um, and the whole Big Brother in a box quote is pretty interesting too. Uh, it's like I think it has two meanings. I don't know if it was intended, but it's like somebody that's kind of helping you out, that has more expertise than maybe the paramedic inside um, the vehicle, but also like Big Brother, kind of just watching there, getting a feed, literally like the vitals feed and all the data on the patient at the same time. That was kind of funny.
Exactly. Exactly, yeah. As speaking of Big Brother, the sun is shining directly into my eyes, so you guys seeing that, that's where that's coming from. Yeah, that's super funny. I didn't make that connection actually. So,
Yeah.
um, yeah, I mean, it's you bring up a lot of cool points. I think my reaction is, uh, what is the what can go wrong, right?
Yeah,
Coming
yeah.
from a hospital background as a pharmacist, technology, my experience at least is that it's great when it works, but when it doesn't work, it's terrible, and we all lose our minds. Um, so I could easily see, you know, for example, like this device requires an internet connection, and potentially even like if it uses like a call function, it needs cellular, basically cellular service and signal. So if that breaks, if they're in the mountains somewhere in Georgia, what are they going to do if it doesn't work, right? And they have no cell phone signal. So who are they going to call? So I can see different technology issues. Wow, sun's getting pretty strong now. Might have to get up in a second. Um, but yeah,
There's a
I
technology
I
called
foresee a couple
shade.
of technology issues. But I think if implemented correctly, with kind of those backup options, this could really benefit a lot of patients where they don't, the ambulances, most ambulances, to my understanding, they don't have this technology anyways. They're
Mm,
kind of in the dark.
yeah.
Um,
Mm,
from what I understand, most of them actually they are routed. They are routed either by a central service that kind of routes ambulances to, like connects the emergency department with the ambulance, and says, all right, this ED at Emory already has 25 patients and they're full. Don't go to Emory, go to this hospital.
yeah.
And they're kind of like an operator there. Um, but I think this can take it to the next level because the doctor can literally be on the line. So
Yeah.
I think it's pretty cool. But I'm curious, so that again, you're the business guru on the show. I'm more of the healthcare guy. How do you foresee the financials playing out? Can this
Mm.
be like a startup? This is funded by research grant. How do they make this make sense financially? As I go and shut my blinds.
Yeah, yeah. Use the technology available to you over there, with the blinds. I think there is as with any other technology, there's going to be, especially connected technology like this, there's going to be a lot of dependencies, right? There's the internet service. That's kind of the basic thing that has to be available within the ambulance and maintained by the ambulance company. If anything goes wrong with the technology itself, Are there technicians available to go and fix it very easily and at a low cost to maintain for the ambulance company themselves? And who's actually paying for that on an ongoing basis? And as with anything where people are involved, is there, at any given time, 24/7, an EM physician available? Right? Like if I put the call in, who's on the other end? Is it somebody who's just kind of sitting there waiting for a call? Are they doing something else, and then they have to, pause from that? How does that work? So I think there's a lot of logistical challenges with it, to make it scale. And you look at, your average ambulance company. Yes, there's a lot of kind of training obviously involved, and including technology that they have to utilize. Even, how do you use the chair properly and things like that. Their entire training is dedicated to those things. I think if we were to take a sort of educational approach and make sure that people are actually educated in these new technologies, to then start actually using it consistently, then it won't just kind of sit there as another technology that came from the top down and never actually got used on the ground, which happens, unfortunately, pretty frequently in healthcare and other industries too. So I think, yeah, there's a lot of challenges. It has to be something where, it's almost like a chicken and egg, right? You need, similar to Uber, right? Like Uber could not survive unless they had, one, a whole lot of technology to make it work, and two, interest from riders and interest from drivers. So in this case, you need the ambulance companies to be on board, but you also need a provider that has enough, physicians kind of on call at all times to be ready to hop on a video in
I
case of an
see.
emergency, right? So
I
I
see.
think it's one of those things where it's not like a bootstrap startup type of solution. You really need some significant money, and expect a large loss for a large period of time in order to really make this kind of technology work. So, either it's a larger company that could do it, or, VC backed kind of opportunity. It's tough. You really need to validate the need. Who needs this the most, and who's willing to really pay for it?
Exactly. That's very interesting. I like the Uber example. It's almost as if they're the hospital is the Uber, and the ambulance EMTs are the people looking for a ride. Like, hey, your
Mm-hmm.
hospital open to take a
Yeah,
patient?
yeah, yeah.
And
It's
like,
going to
nope,
be
sorry.
12 minutes and $1,700, dollars. Yeah,
Exactly. Yep.
yeah.
Super
And
interesting. Yeah. Go
yeah,
ahead.
I think an Uber has orders of magnitude more technology than your average ambulance company. I'm sure it does as well. So, or ambulatory services. I think, and what's interesting is, with Uber, a lot of their value is in the data, and I think it could be a similar play here, where if you are getting kind of a live feed of vitals data, conversation with the EMTs, paramedics, whoever's in the ambulance at the time, and the physicians. It brings, I think, a lot of interesting data that you might not otherwise have, um, to see, how can we kind of handle these types of issues at a larger scale, more proactively, those sorts of things in the future. Um, and there's where insurance might be interested in being able to put some money into this as well.
Yeah, I think what you said makes sense. The big question is who's paying for this? Is it insurance?
Yeah.
Is it the hospital? Is it the ambulance company? But what I'm thinking of immediately is patient outcomes, right? A couple of examples from the article itself. Um, I'm just reading from here. Understanding all the capabilities of the new system and the doors it opens are unimaginable. For example, they said during Hurricane Debbie, several ambulances they set up a shelter doing telemedicine with doctors in
Mm.
Emory Hospital to care for patients, so that they didn't have to go to the ED. So they're kind of like a
That's cool.
mobile ED in that sense, especially
Mm.
a shelter. Another example is where, like, if somebody's having a stroke potentially in the ambulance, the going on the video, talking with the doctor. It can help kind of help them assess what the patient's going through. Is it a heart attack? Is it what kind of heart attack is it? Is this a stroke? Is this pulmonary embolism? Just throwing out big words now. It allows the doctors to kind of manipulate the situation, or like get them to help to save the patient's life before they're even set foot in the hospital. So I think with that being said, I think the pros are definitely bigger than the cons. I think it would have to be pitched, or one angle at least, is as a patient outcome or a life-saving measure. With the biggest issue, even mentioned in the article, was the modem. So they said one of our biggest problems here in rural Georgia is the connectivity with the ambulances.
Wow.
So that really slow internet connection. So I'm sure that that pissed some people off. But yeah, I just want to reroute to my original point. They were already trying to do all these life-saving procedures and assessments without this technology. So I feel like it would just, even if it worked 50% of the time, I think it would, 50% of the time it could save a patient's life. And I feel like, how much do you put value on patient's life? So that's just what I kind of think about. That could be kind of cool, the different capabilities for it. But sounds like on your end, you're thinking of all the challenges with it. So.
Yeah, I tend to do that sometimes, but yeah, opportunity-wise, I think it's a big opportunity, can save lives. Whether it takes this exact form or not, I'm not sure. Right, like the video part realistically could be done from any phone. It doesn't have to be this fancy installed, visual thing there in the ambulance necessarily. And maybe there's some way to, just plug in a USB or something into their existing infrastructure that could potentially stream the vitals and readings over to the relevant physician as well. So I don't know if it'll take that exact form, but it is a cool experiment, and I'd be curious to see kind of after this initial test and study what who's really kind of pulling for it to be continued, or will those screens, it looks like a screen in a seat, almost like the physician's supposed to be sitting in the seat from one of those photos, like just pulling those seats and saying, well, we actually need that seat again, and let's get those screens out of here. So yeah, it's promising. We'll see where it goes.
Sounds like you're hitting no. Don't invest.
Yeah, I mean, I'd say, hey, I love what you're doing. You're doing important stuff. Let me know how it goes after this study, and who's willing to actually pay for this thing.
I see. You're hard.
Besides me as a taxpayer,
you'd be a hard VC to convince. Get your
absolutely.
money.
Yeah. Yeah.
Awesome. Well, just similar to last week, we've seen how telehealth can help the underserved and the marginalized, and now save lives. So super cool technology, and I think if you're one of the founders or one of the doctors from this study, let's connect. You want to come onto the show and talk more about it? Love to hear more about it. So quick thing, if you like what you're hearing, go ahead and give this video a thumbs up. It really helps us out, especially on the YouTube algorithm. Go ahead and click subscribe if you're on YouTube, and if you're on LinkedIn, go ahead and click follow. Just clicking one of those buttons really helps us out.
Awesome. And thanks again to the CEF for sponsoring. Another way you can help us out is go help yourself out. Go to the mycep.com, sign up, enjoy for free to manage your continuing education. Everything from emergency to any specialty and any kind of license and certification is on there. Thanks again for joining. So we will be bringing on different folks, like those involved in this study, others in telehealth and other areas that are innovating in healthcare. If you'd like to be a part of the discussion, just reach out to us. Send us an email. Dave and Kyle Show email should be in the show notes. And if you want to join the online community we're forming, just click the link in the bio and we'll add you to the wait list. Thanks, Dave.
Thanks, Kyle. Take care.